Have you ever wondered what really happens when doctors make you sleep during surgery? Or how it's even possible to feel absolutely nothing while someone operates on your body? That incredible medical magic is called anesthesia, a carefully controlled state that lets doctors perform surgery safely and painlessly. But anesthesia isn't just one thing. It's a whole science that involves different types, levels, and effects on the human body. Today, we'll dive deep into how anesthesia works, what happens inside your body, and the difference between local, regional, and general anesthesia. Let's start from the beginning. The word anesthesia comes from Greek an, meaning without, and aesthesis, meaning sensation. So, it literally means without feeling. Before anesthesia was discovered, surgery was one of the most painful experiences imaginable. People used to bite down on wood or drink alcohol to dull the pain, but nothing really worked. It was only in the mid 19th century that doctors began using chemicals like ether and chloroform to make patients unconscious during operations. That discovery completely changed modern medicine. Now, what exactly happens when anesthesia is given? Anesthesia works by blocking the signals between your nerves and your brain. Normally, when you feel pain, sensory nerves in your body send messages to your brain through the spinal cord. But anesthesia interrupts these messages either at the local site, in a specific region, or throughout your entire nervous system, depending on which type of anesthesia is used. Let's start with the simplest type, local anesthesia. Local anesthesia numbs only a small, specific part of your body. It's commonly used for minor procedures like dental fillings, stitches, or removing a mole. You stay completely awake and aware, but you don't feel pain in the area being treated. The anesthetic is usually injected directly into the tissue, where it temporarily blocks the sodium channels in the nerve cells. These channels are what allow nerve signals like pain or touch to travel. When the channels are blocked, the nerve can send pain messages to your brain. So, you might still feel pressure or movement, but not pain. Local anesthetics are safe and wear off after a few hours as the drug gets broken down or carried away by your blood. Common examples include lidocaine, bupivacaine, and novocaine. Now let's move on to something a bit more advanced, regional anesthesia. Here, instead of numbing a tiny spot, doctors block the sensation in a larger area of the body. The anesthetic is injected near a cluster of nerves that serve that region. For example, regional anesthesia is often used during childbirth, leg surgeries, or arm operations. One common form of regional anesthesia is the spinal block, where medicine is injected into the fluid surrounding your spinal cord. This blocks all sensations from the lower half of your body so you can stay awake but feel no pain during, say, a cesarean section. Another type is the epidural, which is similar but works a little differently and can be topped up for longer pain relief, especially during labor. Regional anesthesia allows patients to stay conscious, breathe on their own, and recover faster since it affects only part of the body. It's a great option when complete unconsciousness isn't necessary. And now, the most powerful and complex type, general anesthesia. This is the kind that puts you completely to sleep during major surgeries like heart operations or brain procedures. But here's an important point. It's not just sleep like your normal night's rest. It's a medically controlled state where your brain's awareness, movement, and pain responses are all switched off temporarily. When general anesthesia is given, usually through an IV injection or gas that you inhale through a mask, the drugs travel through your bloodstream to your brain and spinal cord. These drugs act on several parts of your nervous system to block pain, cause relaxation, and create unconsciousness. An anesthesiologist carefully controls the amount of drug given, monitors your breathing, heart rate, oxygen levels, and make sure you stay completely stable. During the entire procedure, machines continuously check every vital sign. When the surgery is over, the medication is stopped, and your body slowly clears the anesthetic out of your system, allowing you to wake up. After waking up from general anesthesia, many people feel groggy or confused for a while. Some experience a dry throat or nausea, all common and temporary effects as the drugs wear off. Now, let's go a little deeper into the science. The brain communicates through billions of neurons nerve cells that send electrical signals to each other. These signals pass through small gaps called synapses using chemical messengers called neurotransmitters. Anesthetic drugs interfere with these signals. For example, many anesthetics enhance the effect of a neurotransmitter called GABA, which slows down brain activity. Others block the receptors that send pain or memory signals. The result? You stop feeling pain, your muscles relax, and your awareness shuts down safely and temporarily. Modern anesthesia is extremely safe because anesthesiologists, the doctors who specialize in it, monitor every heartbeat, breath, and movement during surgery. They calculate the perfect dose based on your body weight, age, and health condition. They also ensure your airway is clear and oxygen supply is steady. In fact, anesthesia today is far safer than it was decades ago. The risk of serious complications is extremely low. Thanks to advanced machines, drugs, and techniques, anesthesia truly is one of the greatest inventions in medical history. It has transformed surgery from a terrifying, painful experience into a calm and controlled medical process. From numbing a tooth to performing heart surgery, anesthesia allows doctors to work with precision and patients to heal without trauma. So, the next time you hear the word anesthesia, you'll know it's not just a drug, it's a finely balanced science that combines chemistry, medicine, and technology to protect you from pain while your body is cared for. Anesthesia is proof that sometimes the most powerful things work in silence, keeping you safe, calm, and free from pain. I'll see you again soon in the next video. Till then, stay healthy, stay informed, and keep exploring the wonders of science.